Well, so we can have time for questions. We will get started. I'm Robin Truslow, Public Relations Coordinator for Calvert Library. Thank y'all for coming tonight. I also help develop classes for, like tonight's, for the library to offer to the community. So if you have suggestions for classes that you'd like to see, please let us know in chat. And with my wonderful partners, we'll see what we can do. And if you have questions during the panel, please ask them using the Q&A function. Several of us are going to be watching those to make sure we have them addressed today. And you can actually upvote any questions that other people ask that you particularly hope we'll get to. We are recording today and streaming live on YouTube, so you'll be able to access this later on YouTube if you want to share with other people. So I want to thank all of our wonderful partners that really support our small business community with classes like tonight. So Calvert County Minority Business Alliance, who inspired this event, Calvert County Health Department, Dr. Polsky has been wonderful, stepping up every time we've asked him, Calvert County Chamber of Commerce, and Calvert County Economic Development. Our panelists and resources tonight are business attorney Lisa Smith-Sanders, Health Department Director Dr. Larry Polsky, business consultant Joel Hill, and Deputy Director of Economic Development Danita Bunjaisri. So just so our panelists, for those of you who are coming in now, so our panelists know who we're talking to today, you could type in the chat what industry you represent, but otherwise put your questions in Q&A. Looks like Joel's come back with videos, so that's good. We can get started. And Ms. Saunders, if you'll unmute, you can give us an overview of what we'll cover today and then kick off the conversation.
Okay, great. Good evening, everybody. Thanks for coming. I'm very excited to be here. Thanks to my fellow panelists for including me. That's very exciting. So this is kind of grew out of a session that we had with the Minority Business Alliance about business during a pandemic and things that we all have to face now as business owners. And I'm trying to come at it sort of from a legal perspective, but just like everything else in this pandemic, we've decided it really requires a collaboration between lots of different people, from our health professionals, from our business professionals, from the public even. So I'm going to try to hit on some of the legal issues that I know are out there that people are going to have to deal with, and defer to my panelists to talk about some of the other issues, some practical issues, and some resources that may be available. So sort of in terms of the overview, I'm going to share my screen so everybody can see that. There we go. I'm hoping that that is not going to cover up everybody's face, but there we go. We'll try that. So as you said, when I first started this topic, we were just starting to reopen. And so the title started out as Business Not As Usual, because we were thinking, oh, we're going to reopen everything. And of course, 4 weeks have now passed, 4 or 5 weeks have now passed, and things are going back a little bit as opposed to going forward. But I think some of the issues are still out there. Some of you may have already encountered them, and some of you may be worried about encountering them. But things that we are going to look at will be the new world as business owners that we have to navigate. And I've narrowed it down to what I call the 4 L's. We have our labor issues, we have our liability issues in terms of protecting your customers or your clients. We have lifelines in terms of protecting your business. And then the topic that I've added in, Live Long and Prosper, which is sort of the theme of tonight's presentation, which is in terms of just protecting you. Like, what can you do individually for yourself to be prepared for the next pandemic, or in this case, as it may be, an ongoing pandemic. So I just wanted to start with labor, because I think that's one of the bigger issues that most people have. You know, anybody who has employees, you got labor, and there's always issues that come up with labor. And there are existing laws. No new laws have come into place necessarily, with the exception of a few relief packages. But for the most part, we're dealing with existing laws. And the question is, how is the issue of the pandemic even going to play into those existing laws? And in terms of dealing with your workforce, you have considerations for workers' comp, you have considerations for unemployment, occupational safe and healthy, occupational safety and health, accommodations, and whether you've got employees versus independent contractors, and what your responsibility is towards those folks. And looking at, say, the workers' comp issue, one of the questions has come up in terms of what if someone contracts COVID at work? How is that going to impact my business? What am I going to have to do? As of yet, there's not a lot of case law. We haven't had a lot of time for cases to move through the system. If any of you have been involved in those, I'd be interested in hearing from you. But right now, it's a lot of speculation as to what's going to count and what isn't. But obviously, if someone contracts it at work, it's a workplace injury, and that's at least what the plaintiff side is going to argue. So that may end up being covered by workers' comp. So you have to look at really what protocols you're putting into place to deal with people coming into work, and how are you going to keep them safe? Just like you do with any other issues, whether it's machinery or other hazards in the workplace. From a legal perspective, as a business owner, you just want to be prepared. What do I need to do to try to make my employees as safe as possible so I don't have workers' comp claims? So if they're catching it, it's not here. So you can look at what practices you want to put in place, and you need to document those practices. And I think at this point, when I'm talking the legal side, I do want to kind of turn to Dr. Polsky and ask about some of the recommendations probably that the health department may have for bringing people back into work, into the workplace. What sort of protocols should people be looking at in terms of making the workplace a little bit safer? And I will stop sharing this.
Thanks, Lisa. I guess I'll jump in for a little bit. I guess one resource that's important for everybody to know about is the health department. Very early in the pandemic, back late March, we started putting together guidelines that were general for businesses, including symptom screening for employees, and then other guidelines that were specific to different industry sectors. So we have the health department has a separate website specifically for COVID, and the website for that is all one big word: Calvert County COVID-19, no punctuation, just Calvert County COVID-19.com. And then there is a tab on the homepage that has I think we entitled it Reopening Guidelines. And then if you click on that, there are about 16 different links for general reopening guidelines. When we say reopening, that was because businesses had all been closed. Well, a lot of them had been closed by the governor, and we were looking as businesses were able to reopen, and the types of hygiene, sanitation, personal protective equipment, all those sorts of factors, distancing employees apart from each other to make sure, and for customers. So I don't want to get too much into the legal aspects, but it's not just from that standpoint for your staff, your employees, but also keeping your customers safe as well. So we have general guidelines that would apply to, in broad ways, to almost every business. We have employee screening, and it goes down the different symptoms and what to do. And then guidelines for retail businesses, for small businesses, for those that cater toward tourism and attractions. We have both an indoor and outdoor guide, because the preparations and the requirements from the governor's orders are different for indoor and outdoor dining. And keeping in mind that it's not unusual for restaurants in particular to have Spanish-speaking staff, we translated that into Spanish as well. So that's something that employers can share with their staff if translation is an issue for them. We have guidelines for hotels, for daycares, for nail salons, for tanning salons, tattoo parlors, casino and gaming. So we cover a lot of different areas, and some of those clearly will overlap. And then also, I'll just mention that for religious congregations, and it's been quite an active dialogue over the spring, summer, and now into fall about keeping people safe in religious congregations, because you have so many people coming together in what are typically very large open halls. So as far as specifics, I don't want to go into too much detail and take up too much time. There are, again, the resources that we have through our health department. There are CDC guidelines or OSHA guidelines. There's plenty of stuff in print. And I would say that there's no way to make everything safe for everyone. That my experience as a physician, because doctors obviously are not immune to the potential for lawsuits, is that if we are following established expert guidelines and we're doing everything properly, and despite doing everything we reasonably can, something of ill consequence still happens, then in general, you're pretty well protected. It's when you start doing things on your own, start making up your own guidelines as if you are an expert in whatever, that you potentially start getting yourself into trouble. And I'll just quickly say that the one thing that we've seen recently from quite a number of businesses is that they have one employee who gets COVID, and for some reason, business owners and managers are taking it upon themselves to go tell their employees to go get tested for COVID the next day, and then their test is negative, and then assuming everything's okay, and then bringing their employees back. That's not the way the virus works. And so the incubation period for this virus is much longer than for most any other virus. Typically, if I got exposed today, on average, I am not going to get sick for another 5 to 6 days. And for some people, maybe 10, 12 days later before they become ill. If I'm in that situation, my test will not turn positive until 1 or 2 days before I become sick. So if I become sick on day 8 after exposure, if I get tested the day 2, 3, 4 days after exposure, I will test negative, but I'm still harboring the virus. Then I come back to work a couple of days later, and then I spread it all through through all my fellow employees, and potentially for your customers as well. So I would just caution you not to give it. The example I used for one of our local businesses who did it recently is, I doubt that you would go and give your employees advice as to when to get mammograms. So, I would hope you're also not giving advice to your employees as to when to get other types of health screening. Defer that to the experts. That should be either given by the health department, or I would say in most cases, really the best thing is for that individual's personal physician or nurse practitioner, because they know that individual. They have a history, they know what their underlying health conditions, and then they can help guide them as to what would be appropriate.
Can I just jump in, Dr. Polsky, and ask a clarifying question?
Sure.
If they have, so they've been exposed to another staff member who has the virus, so it has tested positive. So they should, what should we do? We should quarantine. We should. What recommendation should we make?
Right. So again, I don't want to turn everybody into many doctors or epidemiologists. And so what should happen in most cases is that people, I'll give a little bit of advice, and again, keeping in mind to try to defer to people who do this all the time. So the first is what is actually adequate contact? And what the CDC has continually recommended all the way through is people who are within 6 feet of each other for at least 15 minutes. And it doesn't need to be 15 minutes in a row. That could be 2 staff people who maybe spend 5 or 10 minutes together, then they go do some stuff for an hour or 2, and then another 10 minutes that they're back together. So you add it up and it's 15 minutes. So anyone who's been exposed to a person with COVID for at least 15 minutes, and that would be in a day. If they're with them for 5 minutes and then a couple days later they're with them for another 10 minutes, we don't start adding up over days, but within a day, and again within that 6 feet, then they are at higher risk. It doesn't mean that they're going to get infected, but they are at higher risk. And then the question at that point is, do they need to quarantine? Which the answer is generally yes, meaning that they should not be in contact with members of the general public, with their coworkers, because again, they could become symptomatic 4, 5, 6, however many days later, and then start to spread it. There are 2 problems with this virus as far as spreading. One is that 1 to 2 days prior to symptoms developing, people are already capable of spreading to others. And actually the day before symptoms start, is the second greatest chance that you're going to spread to others. The first day of symptoms is the highest probability, and the day before symptoms start is number 2. The other is, as most people know, about 40, maybe as much as 50% of people who become infected never develop symptoms at all, but they are still capable of transmitting to others. So those asymptomatic spreaders. And so the safest thing for people who we know have had close contact is just for them to go away for 2 weeks and not risk disseminating the virus all the way through. You'd rather lose 1 or 2 workers for 2 weeks than end up with a half dozen or more of your staff getting sick simultaneously. And then, aside from the potential legal ramifications, just as importantly in the short run, or more importantly in the short run, you may not be able to run your business, or you may have to close early because you don't have enough staff to run that second shift or whatever it is. And of course, for people, especially people who are a little bit more medically vulnerable, they could end up getting really sick. And so the number of people hospitalized in the state over the past week has almost doubled compared to the week before. So we're starting to see more serious illnesses come about. And we had a bit of a lull in the summer, and we're starting to see that rise. So, and the last thing anybody wants to see is one of their staff, to end up getting really sick. So, getting back to the question, quarantining is generally the safest way to go. And then if somebody gets tested again, that should be deferred to a healthcare provider to assess that particular situation and make a recommendation.
And in terms of communicating with the staff that may have been exposed, is that the employer's responsibility? Is there an issue with, HIPAA, health and safety? How does that work?
Right. So HIPAA doesn't apply to anyone other than healthcare providers. So if I find out about someone's illness or health information as a licensed healthcare provider, I am both legally and ethically bound to provide confidentiality. But if as an individual, I would go and tell, somebody, a friend of mine, oh, I got sick, they don't have any HIPAA requirements. So an employer is not bound by HIPAA unless that employer is a physician and they would be told in that context. But for the general, there's no HIPAA. The problem there is, again, once the employer takes on that role of starting to give advice to their employees, then from a health standpoint, again, they may be giving poor advice and people may end up getting unnecessarily sick. And then from a legal standpoint, again, you're putting yourself in a position where you've taken responsibility for somebody's health, and you don't want to do that.
I guess I'm wondering about the contact tracing and whose responsibility is that to communicate to the people.
So that's our responsibility as the health department. Now, I will say that the way the state has set things up is when someone is diagnosed with COVID, the results go to the health department in the county of that person's residence. So if someone lives in St. Mary's or someone lives in Anne Arundel, but they work in Calvert, that case will not come to us. It'll go to the Anne Arundel County Health Department. It'll go to the St. Mary's Health Department. They will be responsible for contact tracing. And so sometimes things get a little confusing when people get, notified by somebody outside their county. And I was going to mention one other thing. So the other important thing is that there are times where we try to get a hold of people and they refuse to answer the phone. And we can't force somebody to pick up a phone. And we can't do contact tracing if the person on the other end is not cooperative. So one of the things that employers can certainly encourage is if they know their employee has tested positive, or if they're going to get a test when the results may not be back for a few days, to strongly encourage their employee to make sure that when the health department calls, that they pick up the phone, because again, we can't contact trace unless we talk to the person with the infection.
Great, excellent clarifications, thank you.
Right. I think that's some really useful advice. And I guess I would say from a legal perspective, employers need to at least go to the health department website and find out what the general guidelines are. This is really more about planning than anything else. And I can't tell you that you absolutely will be protected if you, legally speaking, if you implement these things. But I think you want to have at least some plan. And you may need to just sit down and talk to your workforce too, and one, so that they're comfortable telling you if they've tested positive, as opposed to just keep showing up at work and don't say anything to anybody. And then, in terms of letting everybody else know what they have to do, and we'll probably talk about that a little bit later tonight. I think Joel will have some really good ideas on that. Just setting in place a plan for what do I do if somebody does test positive, and it's one thing if they test positive outside of work, but if it's something they catch at work, yeah, it may impact on your workers' comp, but it's certainly going to impact on your operations, because you do need to make yourself safe. You got to think about customers, how many members of the public are in and out. So planning is really going to be important, I think, even from the legal perspective, to show that you've at least done a minimum amount to make your workplace safe. Has anybody actually, I did try to look to see if there were any workers' comp type cases out there yet, and I did not find any, but I don't know if any of our participants may themselves have been involved in any cases like that coming up yet, and maybe have some insight.
So that maybe because the courts have been shut down for almost this whole thing.
Well, that's true. I think all of the workers' comp hearings are remote, and they've got protocols set up for that too on their website. So I don't know that any of those have actually come to light yet, but I'm waiting. I'm sure they will. Along those same lines, one of the other areas in terms of your labor force is going to be unemployment as well. And from a couple of different perspectives, I know sometimes people have had to lay people off because of lack of work, but now with the reopenings and now the reclosings, and however you want to term them, I think you're going to have some issues with employees who won't come back, and maybe sometimes for very legitimate reasons, because if they do have underlying health issues that your workplace can't address, they may tell you they can't come back. So those folks, when they do apply for unemployment, I'm not going to say that they absolutely will get it, but they may get it, and there's a lot of caveats on top of that too. But we probably are going to see some upticks in unemployment figures from people just not, either they can't or they're not willing to come back into the workplace because of stuff that's going on, because of pandemic concerns.
So, Lisa, real quick, a quick question. So the people who are concerned about unemployment maybe not being available at the end of the year, if that is just to extend it with this additional services, but unemployment is going to be available, is there, what's the concern that people are having at the federal level with unemployment, with the government or federal government supporting that at the end of the year?
Right. Well, I think that is scheduled to end at the end of the year with the federal government supporting that, but I think that still doesn't eliminate the possibility that folks, we're doing this other brief shutdown, reinstituting restrictions. If someone doesn't come back to work in December, they can still go file an unemployment claim. They still have to meet the same requirements they've always had to meet to file unemployment. It just means that after December 31st, there's no federal program specifically geared towards COVID that's there to necessarily help them. I actually had pulled up another screen from, I will say, if you go to the Department of Labor, the Maryland Department of Labor's website for unemployment, they have a nice long list of questions and the answers on who can get unemployment and who can't. The federal program, the Pandemic Unemployment Assistance Program, will end at the end of this year, but unemployment assistance is still there. Unemployment insurance is still there. And if I can't come back to work because I think the workplace is a hotbed of exposure to pandemic, I can still not come back. You can say, oh, well, she quit, but they're still going to look at the issue of, did I have a good cause to quit? And that's going to, again, that's why I say you want to make sure you have at least a minimum safety protocols in place to say, I did all I could do as a business person, all that I'm required to do. I mean, you don't have to wrap everybody in bubble wrap, but you need to at least show that you're doing the minimum to keep your workplace safe, because if someone makes that claim that I can't go back to work at that place because it's unsafe, you want to show that you tried to do what you can to make it safe. And that's existing law. That's not even dealing with the federal pandemic assistance. Okay, anybody else?
Thank you.
Other things to look at, you know, in terms of not just with unemployment, but, you know, do you need to offer accommodations? What if certain workers can't come back in, but is it possible for them to telework? You know, you need to look a little more closely at maybe things you wouldn't have done this time last year, but now they may be more available to you, and it may be something you need to offer your workforce, because, you know, your employees don't have to come and tell you that they have chronic emphysema. Maybe you know that, but they don't have to come tell you that. But if they're afraid to come back to work because they know that they're in a high risk area, you might want to at least be able to offer them some kind of accommodation, whether that's telework, whether that's a private office, what have you, before you tell them, sorry, that's your problem, and that you can't come back in. So you want to try to be a little proactive with that.
Lisa, if I can jump in for a second. Today at the health department, we made plans to phase back to some degree of telework. We did that back in the spring. During the summer, as things eased up, pretty much everybody was back on site. We had a few people who have serious underlying health conditions. They've been working from home through the whole thing. But the reality is that for most of our staff, they can be more productive, more collaborative when they're on site. But we've been seeing the number of cases go up significantly over the last 2-3 weeks. And honestly, I think we're heading into a bad next few months. And I'm concerned that the potential for people bringing the virus into the workplace is going to go up substantially in the near future. I don't want to wait to end up with an outbreak, and especially, you know, you can imagine an outbreak at the health department. That doesn't look very good. But it doesn't need to be an all or nothing. And for some businesses, it's impossible. And it's direct customer service. You have to be there on site. But there are a lot of other businesses that there are positions that you can do, you know, either all telework or you can do a split. So we're going to have like our environmental health people. They need to be on site for a lot of things, but they don't need to be in the office all the time. So we're splitting them in half, and half will be in the office 1 week, and then they'll do their inspections and then do their paperwork at home the next week, and then the other group will flip in. So what we've done is we've decreased the number of people by half. We're able to space people much more. So there's half as many people that potentially can bring the virus in, and those that are there can space apart much more than the 6 feet that, you know, we would be as concerned about. So think about, you know, are there people who could work from home maybe 1 or 2 days a week? Even a 20-30% reduction in density of people there is going to have a significant impact on decreasing the potential for virus spread.
And I will say that's one way the courts have kind of dealt with this too. You know, I think since March, I've only had to actually be at the courthouse once, and that was, again, usually when you go there and there's a cast of thousands, there were probably 12 cases altogether, so that they could spread everybody out across the courtroom, and everybody was masked and everybody had plexiglass. So are cases moving much slower? Absolutely, but they're trying to reduce the number of bodies, quite frankly. And as the registrars in the District of Columbia Superior Court said to us, reopening will not mean going back to the way things were. Reopening will mean we're in a new world. So they've already warned us. You're not going to get same day service from us, and you're not going to have 20 people just sitting here waiting to help you. You may come in and there's only going to be 5 of us. So they've already warned us. I didn't know if any of our participants or any of the other panelists have any anecdotes to share with us about things that they've come across as well with dealing with workforce, with their own workforce. Any questions? I didn't know. I haven't been watching the chat, so did we have any questions yet on that?
Nope, nothing's popped up. Still good.
Okay.
In the chat box, I'm sorry, Lisa. In the chat box, I did put the website for the guidelines we have for different types of businesses. So if people want to go into the chat box, they can cut and paste out that website.
Okay, so moving down our little list. And I think we talked about just trying to really sit down and devote some time to planning what you think you're going to have to do with your workforce when they come back. Oops, apologize. I'm not particularly adept at using my cursor on this. Okay.
And also throw out that as the schools continue to kind of gyrate as what they're going to do, also keep in mind about flexibility for working parents that are probably a little more stressed.
Yes. That is very true, because that is fluid. That's changing very quickly, I believe, in terms of what's happening.
Well, it might be changing right now because the Board of Ed is meeting at this moment.
Oh, wow. Okay. Talk about unemployment, workplace safety, making some accommodations, and just to remind people, there are existing laws on the books that may also impact what you do with COVID, ADA issues, age discrimination and employment issues, Title VII claims. I guess my general advice to folks is, just try to be fair with your workforce. This isn't the time to now use the pandemic as a time to get rid of people. We still have some rules we have to follow, so we want to make sure that we do that and be consistent. That's why I also recommend at least trying to come up with what's your return to work protocol, what's your cleaning protocol, what's your scheduling protocol, so that everybody feels like they're getting the same fair break and not that this person's getting a better deal than this other person here. And that will generally serve you well on the legal side. Of course, I think you have to also consider your liability to your customers. And that's down to, how safe is coming into your place of business. And again, I think from I guess I would treat it as you would any other tort situation, is my duty of care is to make this reasonably safe environment. I don't leave wet spills on the floor so people don't slip. So, I don't have my staff cough on my customers so that they don't catch COVID too. So I think you just, again, want to have a recognizable safety plan in place, some protocols, at least a minimum. This is our policy. We require masks. We require we have hand sanitizer every 6 feet in the building, that show that you're following some type of guidelines. And again, not your made up guidelines, but guidelines that I can trace this back to my local health department, to the CDC, something like that. Not like my great aunt Bertha said that we should all drink honey ginger tea, something like that. We want to make sure that you have something from a legal perspective that we can show lowers the risk. Is it going to be 100%? Probably not, but you need to have something in place. And you need to try to do something, I think, to help your staff as well deal with customers who are a little more irascible about that. Give them some guidance on how they should react when they meet resistance to trying to enforce your rules that you put in place. Public lifelines. Lifelines are really about your business. This obviously puts a crimp on all of our businesses when we can't have everybody on staff, when some people are working from home, when in my case, the court that I'm used to just walking into, I can't just walk into it anymore. I have to plan things out. Everything takes a little longer, but of course that also interrupts a lot of how your business operations go. And I know Joel's got some really good ideas on things that you can do to make that transition a little bit smoother, but I think you do want to look at what resources are out there to help you financially and operationally. I think that things that you may not have thought of before, business interruption insurance. It's the kind of thing like, yeah, the flood's gone through, now I want flood insurance, but yes, that's something you might want to consider when you do have to shut down, whether you can get the insurance to cover the gaps sometimes. I know that there were federal programs out there early on. I don't know that they necessarily helped everybody that they were supposed to, but there are other things out there to kind of help you keep your business afloat. It might not be growing, but at least if you can tread water until we can get over our crisis, and just prepare for those losses. And operationally, I recommend looking at things like your contracts. It's the best example I can use is I'm a former dance mom, and we have contracts in the dance world, and you're paying for a whole year up front, and you got to pay for that whether we have classes or not. So when all those classes went virtual, that wasn't written into the contract, but it is now. So now it's, if I have to have a dance class online, it's supposed to count just like an in-person dance class. So those are the kind of things you might want to look at for your business to see if you need to adjust some of those things to allow for these emergencies when they come up. Because this is an emergency we've never dealt with before. Let me back up a minute. And before I get to the business owner themselves, also things to look at in terms of operations to keep your business moving along is cross-training some of your staff, preparing for off-site work. What things does everybody need? Can I get everybody a laptop with a camera so we can do Zoom? Just things like that. If you can plan ahead, we don't necessarily have to worry about scrambling like we did this time, because now I can't find a webcam because everybody has bought a webcam at the same time. These things, we now have a little bit of a breather. We should probably plan for that. And I hope that Dr. Polsky is wrong and that we don't go into another 3 months of upheaval. But if we do, this is now probably the time to plan. So think about the things that we didn't have in March that we wish we'd had when this all started, that maybe we still don't have. Well, now we probably need to put those into place just so we can be prepared. Everyone in my office, we have a digital calendar with digital contact information so we can call any client from anywhere, wherever we are, to say, don't come in because we're going to do this by Zoom. So we just you want to make sure you have some of that in place now rather than waiting for the hammer to drop again. And I guess my last piece was on the business owner yourself. You need to keep yourself healthy and safe and happy, because for many of us small business owners, if something happens to us, the business can't function. And that is a good time for also cross-training and bringing some other people in and talking about your business succession plans and making sure everybody knows where I say everybody, the people who need to know that they know where the passwords are to get to the information they need, because if you're the one who's sick, that will definitely be a problem if you can't give any instructions from your sick bed. So this is a good time to put some of that in place so you don't have to also worry about that while trying to get better from an illness. And with that, I actually would ask Joel to jump in and give us some of his experience and great advice on keeping your business running. And how does that go?
Thank you, Lisa. And first of all, I would say good evening to everyone. And what an honor it is to be here on a panel with such esteemed panelists. And I thank you for the invitation. And at first, I kind of wondered why I was even invited to this forum in Calvert County, because I have to give full disclosure. I am coming to you from one of the greatest counties in Southern Maryland, that's Charles County. And I have to say that, business is operational, and business can work in a pre and post COVID environment. But there's some things that need to happen. And as you know, I'm a consultant. And I consult on business processes, and we initially started providing background screening services to our clients. And we did a lot of things on site. What this COVID has done for us is made us completely reimagine how we do business and how we deliver our products and services. So everything that we did previously last year, we are not doing anymore. And so, as Dr. Polsky said, things will not go back to normal, and we have positioned ourselves, to try to support our clients. And we primarily function in the business-to-business professional services. So the industry that we're in is a little different because now, I'll give you an example. We provided background screening, drug testing, fingerprinting products on site, and we did that for different segments in the industry, such as nonprofits, healthcare, service workers, and things of that nature. And so we would go on site and physically have to handle specimens. But we no longer do that anymore, because now everything, one of the things I have to give a shout out to our county is that I actually early on reached out to my local small business development center. I reached out to the economic development department. I reached out to my actual county commissioners, and I had meetings with them. And I've even had the opportunity to talk to my national level representatives in Congress, at the congressional, at the federal level, as well as at the state level. And I'm thinking, wow, I'm just a small town business person, but what I've discovered through this whole process, going through this thing, is that it's about people and the relationships that you form, and that the pivot that needs to be made is what Attorney Sanders was talking about. The number one thing really it's about your people. It's about people. It's about taking care of your employees. First of all, making sure they're safe, whatever industry they're in terms of communicating that on a consistent and daily basis. And so that's what we found, and we've made that pivot to help our clients do that sort of thing in terms of their communication, because obviously everyone knows that this is a new environment, but I couldn't tell you what was happening from one day to the next. But the one thing I do know for sure right now is that it's about people, and businesses in terms of their marketing strategy. They need to be focused more instead of on their bottom line. They need to be they can benefit more from acts of kindness and generosity, as well as building relationships with their customers and their clients. We've kind of been, even though we are a global company, we've been forced to become more local and establish trusted relationships with the vendors that we deal with. And so you can, whatever industry that you're in, I urge business owners to think about, doing things without expectation of something in return. Because as you know, we are all in this together, because we are still a community. And if you look at Charles County, if you look at Calvert County, if you look at Southern Maryland, you got to understand that there are relationships, business relationships there, and that there are vendors there who can satisfy your supply chain issues that you might be having. There's a reason why the mail is slowed down. Sometimes FedEx doesn't come on time. And so I encourage, and what we have to do is find local vendors to help us provide our products and services here locally, instead of looking outside of the region. And so that's what we did. We increasingly are using email now to communicate, not just to I'll give you an example. One thing we try to do is not just send emails for marketing purposes, but really just to find out how they're doing. You know, and it really gets down to the personal level in this situation, because it really is about us and everybody that you know. And so we are trying to take the time to strengthen our bonds and develop relationships instead of simply just talking shop and asking for a sale. And so one of the things that, as you probably know, when I talk about reimagining, repurposing your business, you know, sometimes, you know, we have to change, you know, how we deliver our products and services. So the industry that we're in, you know, for example, we did drug testing. We went on site, but now I had to establish a national level account with a national level lab core to be able to provide those services virtually. So it's contactless. So all we do now is send out links, and basically every day that we do. So, and we still provide our client, which is a nonprofit here in the county, the same service that they need to drug test, fingerprint, and background check the employees, because there are businesses that are still hiring, and they still need employees that are trustworthy. They still need employees that have the requisite skills. And so we are able to help them do that, do, you know, virtual interviewing capabilities, and providing those tools, as Attorney Sanders was talking about, you know, with her calendar function. Those little small micro application things are very important in terms of making a deal. So again, if I had to summarize, it really is about people and not so much about technology. It is about people connecting on a human level. So it really doesn't matter. And so in a lot of ways, you know, the pandemic has, you know, kind of hopefully forced people to really look at relationships. And that also includes our business relationships.
Great. That's a great message, Joel. Thank you very much. I'll come back on screen so y'all can see me. But I think one of the things that I heard both of you and Ms. Sanders say is taking care of people, and whether they be the people that work for you or your customers, that's a real priority. And I was really super glad to hear that. And I think of some of the things the library offers that may help in that are also still productive for small businesses. I think we have a lot of free training courses online. We have a subscription to lynda.com. You just need a library card, and you can take all kinds of business courses, technology training, things that can add marketable skills to your employees' workplace. Maybe they'll learn how to create a more technology focused work efficiency that will improve your business. When you might not have enough customers at that moment to activate your employees, but there are things that you can do that are still beneficial to your business and also keeps your employees engaged. So those are some things the library has. We also, when you talk about having resources for your employees to work from home, and they're hard to come by, the library's found that too, but we do have hotspots that are circulating, so that can provide Wi-Fi sometimes for your employees. So that's something, they're free. We are soon going to be adding Chromebooks with additional hotspots as well. Are there things, Danita, that you know of in our community that might be useful to small businesses?
Absolutely. First, full disclosure, I was voted Class Optimist 1980 Thomastown High School. So I am ever the optimist. And I wanted to give you a couple bright spots in the middle of all this gloom. The September unemployment rate for the state of Maryland was 6.9%. For Calvert County, it was 5.0%. If you had asked me back in April what our unemployment rate would be right now, I would have told you probably 20%. So that's really encouraging to me. Now, I realize that many of our residents work for the federal government and have not been, disenfranchised from their employment. And I also recognize that we're talking about a K-shaped recovery. For all those people who are doing very well, there are some people who are doing very poorly. And they're really fearful of what the next 6 months are going to bring, whether it's personally in their home life or professionally in their business. Lisa and I spoke just before we came on about some of the fears I have about commercial tenants being, on the bubble and trying to pay their bills, and what's going to happen when the executive order expires in the state of Maryland and evictions become allowable once again. So we're trying to help as best we can. We're being realistic about this. While I am optimistic, I'm also a realist, and I recognize that there are many businesses and many people that are suffering out there. One of the other bright spots, I think, is over the past 6 months, maybe shorter than that, it seems like 6 months, we have come into more than $2 million in grant funding that we have given out to our business community. In my nearly 25 years of economic development, grants were not a thing that ever occurred. So to be able to just hand a business money and say, here, go make your business better, do what you need to do with this money to survive, has been really satisfying for us to be able to do that and offer that. We're also about to embark on what we're calling an Act Confidently campaign, where we're trying to encourage the citizens of Southern Maryland and Calvert County to shop confidently, to discover confidently, to get back out there confidently, knowing that our businesses are doing all they can to keep their employees and their customers safe. I think Doc Polsky would agree with me. One of the big surprises I had when this first happened, when we went to shut down, I thought all businesses are going to be chomping at the bit to get back open as quick as they can. They really weren't. And one of the biggest concerns they had about opening too quickly was fear for their employees. They really wanted to open safely and cautiously to ensure that they didn't further infect or endanger the public. Would you agree with that, Doc?
Absolutely, I do. And to touch on another point you mentioned, at the health department, we get complaints every day from customers, consumers out there who see businesses that are not doing things well. And they realize that they are not going to go back to those businesses. So that taking an extra little bit of time, educating, working with your employees, because they need to carry out the policies you put into place. And as Joel had mentioned, employees, they appreciate that you care about them. They take pride in doing their job. And then that translates into customers that feel comfortable coming back into your business.
That's correct. And back to your question, though, Robin, about what is available. We always considered ourselves as being a hub with many spokes, but I'll follow on Lisa's example. And we really are a lifeline. We have many partners, many collaborators, many resources available at our disposal. Robin, you're one of them. Calvert County Minority Business Alliance is another one of them. Small Business Development Center, SCORE, the Maryland Department of Commerce, Maryland Department of Labor. I even have a contact at the governor's office, and I have pulled that card at least twice since this has been going on for citizens who just could not get through the bureaucracy. And we don't hesitate to do that. So if I had to offer one piece of advice, do not sit out there and suffer. Do not sit out there in fear. Do not sit out there and worry. Reach out to us. We pick up the phone. We have been working constantly since day one. We're working from my dining room, but I have been working every day. Everyone in our office has been working every day. The Board of County Commissioners, in their wisdom, deemed us essential employees from the very beginning of this because they knew our businesses are essential and somebody needs to assist them.
You just muted yourself, Danita.
I was trying to put my chat in there. So there's my contact information. Reach out to us. Let us help you. Let us direct you to a place where you can get the resources you need. I see Dawn Tucker was asking about rent and utility mortgage assistance. Jennifer Moreland in our Community Resources Department is working heavily and closely with the community because that's another big issue. Private, individuals who are worried about mortgage and electric bills and water bills, and she's got some resources at her disposal to help with that. Unfortunately, I started off by saying I'm an optimist, but unfortunately, I think we have not seen the bottom yet. And I'm worried what the winter months are going to bring for businesses that tend to, especially in Calvert County, they tend to suffer a little bit. January, February are dark months for many businesses, especially this year when they didn't make up the bulk of their money during, the summer or the fall. So we're going to be working constantly to try to bring whatever resources are available. We have exhausted the current funding that we have been given by the federal CARES money and by the Maryland Rainy Day Fund. But I am optimistic, again, to end on an optimistic note, that more money will be coming. So I advise people to stay tuned to our website, sign up for our e-newsletter. The minute we get additional funding, we will do everything we can to get that back out to the community.
This is great. I think really it's been wonderful. I think the messaging we've heard today is there are a lot of resources out there, a lot of people-focused resources and small business-focused resources, and they are really we're all waiting to help. So if you have concerns, as you said, Danita, just reach out. So I really appreciate everybody coming today. Really very useful information. Again, this will be posted on YouTube and can be shared. Yeah.
Just one last thing, because we've been talking about, you know, taking care of your employees, having a robust workforce. We're coming on flu season right now, and every year businesses suffer dramatically because of all the days lost because of the flu. So right now, unfortunately, we don't have a vaccine for COVID, hopefully in the not too distant future, but we do have vaccines for flu. But we know that slightly less than 40% of adults in the US get their flu vaccine. And because of that, we end up with just literally millions of cases of flu every year in this country. On an average year, 20 to 25,000 deaths. It's the 8th leading cause of death in the country in a typical year. The last 3 years, we've averaged 70,000 deaths because of the flu. They've been very bad strains. If people took the time, which doesn't take very long, because you can go to your family doctor, you can go to almost any pharmacy around and get your flu vaccine. That will help keep your workforce healthier, more productive. And when the flu hits, kind of like with COVID, you're not going to lose one person. Oftentimes you lose 3, 4, 5 people at once, and you're struggling to keep your office staffed.
Well, and let's get this. Go ahead, Dawn.
Real quick, you know, this Saturday, November the 28th, next Saturday, is Small Business Saturday, sponsored by American Express. And there are a lot of resources that are available to promote and do things virtually. So all these other resources that are out here in the library and economic development and the health department, our businesses, this has been to me a very helpful and extremely important, especially where we are in the timeline with COVID and pandemic. So I've gotten a lot out of it. So the partnerships, this was really, really an excellent webinar.
I hope it's not a sign of something dark that Lisa has left the boardroom and gone to the Death Star.
Right. Well, I just wanted to point out that, you know, it is possible to enjoy yourself even during a pandemic. And I enjoy myself by switching up my backgrounds depending on what I'm doing. Though I will say that it was small enough, I was like, I can't tell if that was the Death Star or the Rebel Alliance, but whatever, it's Star Wars. I thought I had a good Star Trek one to go along with Live Long and Prosper, but there you go. Yeah.
I think that is supposed to be the good guys.
Yeah.
All right. Well, this has really been very helpful. A lot of great information and really wonderful partnerships. It's really wonderful to see how everybody's pulling together. And I hope you will take the opportunity to share this information with other people. The YouTube link will go up. I'll send it out to everyone afterwards, to all the registrants. There is a survey in the email that I sent out. It's very short. If you'd like to, it's a great opportunity to give us feedback on this, but also to give ideas about other classes that you might like to hear about. I think it was, I can't remember if it was Lisa or Joel who said, take care of yourself too. And you know, that healthy piece, taking care of yourself physically is important. And we may actually have a session in the new year from a personal trainer to give us some information about how to help us stay healthy. So again, thank you all for coming. Thank you so much, Ms. Sanders, Dr. Polsky, Joel, Mr. Hill, Ms. Boone-Chaudry, and Ms. Tucker. Thank you for this. It's been a great presentation. Thank you so much.
Thank you for having us. Thank you. Everybody take care and happy Thanksgiving.
Yeah, you too.
Bye-bye.